Now we are live, ma'am.
Okay. Thank you, sir. A very good afternoon to everyone who have joined us today. I, Bhavna, on behalf of the entire Department of Economics, I would like to welcome Principal Ramanujan College, Professor S.P. Agarwal, sir, honorable guests of honor, Dr. Ujjwal Vaid, Dr. Ushma Singh, Dr. Dinesh Singh, my colleagues, and all the participants who have joined us on this platform and who are live with us on YouTube to this panel discussion today. These are challenging times, and we sincerely hope that everyone listening to us today is in best of their health, and we wish the same for the future. The ever more rapid and extensive spread of COVID-19 pandemic has become a major cause of concern. We are seeing endless number of rising cases every day. Out of the 8 members of our department itself, 5 of us are either fighting or have overcome this virus. But as we know, every challenge can be turned into an opportunity. And to prove this, our department has come together to make the best of these difficult days. Today, we will be organizing a panel discussion on the topic health awareness and resilience of COVID-19 pandemic. The aim of this program is to spread the awareness of COVID-19 disease and related infection control practices among college fraternity and students and all the participants here, and also make them aware about the new wave of pandemic. As this pandemic wears on, ongoing and necessary public health measures expose many people to the experiencing situations linked to poor mental health outcomes such as isolation and depression, and not just the physical challenges that we know of. The event aims to help infected patients, caregivers, and concerned people relieve or at least be more prepared for the mental stress and anxiety caused by the threat of the virus. I would like to welcome you all to this panel and hoping that everyone will be better aware and even more prepared to fight this deadly virus as we conclude this lecture. On this note, I would like to call Principal Ramanujan College, Professor S.P. Agarwal, sir, to welcome and address the August gathering. Sir?
Thank you, Bhavna. Thank you. You said that you hope that everybody is all right, but I think nobody is all right. So that is the thing. First of all, let me welcome our guest who has agreed to be with us this afternoon, Dr. Dinesh Singh and Ushma Singh. I can see them together. And Dr. Ujjwal Vaid from ILBS. And both Dinesh Singh and Ushma Singh is, I think, from Max Hospital. Another important thing, though we would like to listen to our experts, but we have several colleagues and most of our listeners are young minds. So, sir, accordingly, you can address them. But first of all, I would like to make few points, before you take up this, talk today. As a common man, as a educated common man, I can say, that there are a lot of things which goes in our minds and a lot of things goes in youngsters' mind. But we need to understand this pandemic. We need to understand this virus. We need to educate more the people. The first important observation I would like to make as a teacher, basically, because during this COVID in the last 1 year, we have trained about 100,000 teachers, converting this as an opportunity to converse our teachers how to do online teaching and how to make it more interesting and, make it so lively that students should not feel that they are not in a live classroom. So that is one thing we did, and we took that challenge and we have reached every part of the country, through online mode. And we have invited experts not only from India, but from everywhere in the world, because these things have become easier now. But what I see as when I listen to various TV debates and various other talks, what I feel is that there is a serious need to train our young, doctors, young professionals, how to treat this pandemic, how to treat the COVID. Because now it has gone to villages, to smaller towns, to each and every part of the country. Earlier, it was much more a, city disease, or we can say urban disease, but now it has gone everywhere. So now more and more trained professionals are needed. And also how to treat and how to manage this disease. Well, I can share a few of the things. Like, when this pandemic started in March, we saw that one or two of our colleagues, they had suffered from this, but that was very mild. They came out of it very flying, with flying colors, no problem, and we were going very regularly to our institutions and doing our job. uh, but when this wave started, and suddenly, the people getting sicker and sicker, and what we call it, the intensity was very, very high, and people are suffering for 10 days, 14 days, 15 days, and some of them need, the ICU, or we call it oxygen, or whatever. The two three things, the observation is that, since this COVID is, we can divide it into three parts, maybe first 5 6 days, then 6 to 10 days, and then 10 to 14 days. And if there is any problem, then it might continue for another, months or two. uh, the first thing, when it came to, surprise us, was that, in my family itself, one fine morning, my son got a fever, and we suddenly took it aback, and then I immediately took a step that, okay, he is running a fever of 99. Maybe let us wait. We gave him paracetamol 2 3 days, and then we go. Whole family went for testing, but it was negative. So that was a big relief. And then, the fever of my son is not going. It remained at 9900, and no other symptom, nothing. And but it continued, and he's feeling sleepy and all that. And then suddenly one day he said, my taste is gone. Okay, well, so that means, in spite of RT-PCR negative, probably he had a, the COVID. And on 10th, or I think 9th day, by giving a few medicines, he was okay. So now the situation comes in another situation in my family itself, in in-laws family, that, few of them got sick, and they did not get themselves tested. They recovered. But one of the older people, they she developed, though tested negative, again tested negative, and she developed, that CT, was moderate. And then we started with the steroids and other things. Now the question arises is that how to treat. That is one, very important. And then once it is in the advanced stage, then what should be done? So these are, I think, 2 3 questions which, everyone has in mind. But I can say, yes, lifestyle plays a big role. you know uh, you know I, I, I always, eat at home. I always do exercises. I always do pranayam. I always do, the yoga and all those things. So probably those people who are maintaining healthy lifestyles are able to face it much, much better. That is a universal fact, I think. So with this, once again, welcome all of you, and I hope you will enlighten us more on these things. Thank you very much.
Thank you, sir. Thank you for sharing, sir, for such sharing such kind words and always motivating us, sir. Uh, uh, we all, like I personally also have been suffering from COVID, and I have recovered recently. So I can completely relate to whatever you have said, and these phases of COVID that we see. My mother and I, we both, by God's grace, we are fine. I think that's what we can say, because we are just depending on some regular medicines that we can get. So we're just hoping that this could bring a better awareness to everyone, to all the participants, to college fraternity and the students. And without wasting any time, I would like to call upon Kanupriya and Sharik to proceed with the lecture.
Thank you, ma'am, and Principal Sir, for your words and giving us the opportunity to be a part of this one informative event. I hope everyone is keeping safe and taking care of themselves in such trying times. I am Kanupra Mittal.
And I am Sharik. We both take the privilege of hosting today's virtual event on behalf of Samvad, the literary discussion circle of the Economics Department on health awareness and resilience of COVID-19 pandemic. In this webinar, there will be a panel discussion and the queries will be taken at the end of the webinar so the attendees can put their queries in the chat box.
With this, I would like to call Dr. Ushma Singh, Senior Consultant, Pediatric Oncologist and Hematologist at International Sri Agrasen Hospital, looking after pediatric population with cancer and patients of hematology in COVID times. We welcome Dr. Ushma Singh to share some guidance to the attendees so we can keep ourselves safe from the deadly virus.
Thank you for your kind words. And I just heard Professor saying the common problem society is suffering nowadays. And there's a lot of fear how to manage it. And every person is running behind all sorts of medications, all sorts of tips from any faculty so that they can deal with this COVID, but people are not very serious how to prevent it. First step is to prevent it, how to get infected. So every time you have to be cautious about that the person next to you or the air in which you are moving is infested with the virus which you can inhale and thereby develop COVID. My experience is that even I suffered. I was wearing mask all the time. Just for few moments, I took off somewhere here and there, and I got the COVID. So you have to be very careful regarding getting infected with the virus, because this virus is a mRNA virus. It is highly infective, and nowadays it is doubly mutated, so that it's all angriness has come into the society. Every person who gets it is bound to affect it because this is very light virus. Earlier, the transmission was through droplet infection. Now it has come to the level of aerosol, means the lighter viruses are moving in the air and they remain suspended for a longer time. So you won't even know that the air you are breathing in is already having virus with it. So fomites, we are slightly worried about whether fomites are the really things which cause the virus, rather than aerosol is the better explanation for this infestation. So I would say children should be made health inspector, because now with the new COVID wave, the children are supposed to be more affected, because sooner or later elder will get infected, they will develop some immunity, they will get some kind of vaccination, so gradually they will be more resilient to infection as compared to our children. And the children are exposed to the elders in the house, so that's how children don't wear mask. So we should first and foremost guide them that they are appointed as a health inspector of the family, make them guard of the family, so that they they tell everyone in the family to wash the hands. They should be explained how to wash the hand, and then they take care of the family, whole family, how to wear mask all the time. Even nowadays we recommend to wear mask even in home, because if somebody is coming out, some people will go out definitely to fetch the livelihood. So once they are coming out, they may be in asymptomatic kind of person. So masking at home is also in very sensitive people. See, old people, diabetic, maybe hypertensive. So all the persons who are suffering, maybe normal in the family, but should wear mask. This is a better logic, although it doesn't seem very easy to be followed and practiced, but it should be norm. And I say children made inspectors so that they take care of themselves and also their family members. Uh, they are basically listening to the television. Lot of knowledge is coming from the television, from the media. So nowadays I see that people are very scared. Their mental health is going down. Their fighting capacity with the disease, because their morale is going down. All this knowledge which is incomplete makes them rather scared, so they are not behaving in the way they should. A COVID appropriate behavior is not coming, because we are just practicing the things by the fear. But it should not be fear, it should be wearing proper mask, hand washing. Hand washing should be with soap. Soap is the best thing. 20 seconds wash, 40-second wash with the soap or alcohol based sanitizer. So everybody should follow this, should be norm of the society, that mask, and mask in the proper way. Now if you are wearing cotton mask, it should be double layer. Double layer mask is advocated, or it should be, if it is a medical mask, it should be N95 in whenever you are going out of the house. So this is norm with everyone. Hand washing with alcohol based sanitizer or maybe soap is the best option. Nutrition should be taken care of properly. uh, it should not be that taking lot of kadas, so people are just running after all sorts of things, taking in excess, which is ultimately causing them, apart from anxiety, restlessness, it is also causing them gastritis. So they are ultimately harming themselves. So by this saying this, I would like to say that as a doctor or as a person, there should be common knowledge that we should identify, risk stratify the disease, because every COVID patient is not a serious patient which will land up in the hospital. 80 to 85% get cured, provided they follow the proper instruction. Because once you are not following your symptoms, you are not taking care of your nutrition proper, taking care of your oxygen saturation should be measured, it should be taught to everyone. Once the patient is infected, should not panic. First thing, foremost thing is, should not panic. Take a good nutrition, maintain a chart which will show you the temperature record. If possible, you should get oxygen saturation pulse oximeter. You can get in the market readily. Lot of zinc, lot of people are running after in the market. Lot of vitamin C is actually not going to help. So you should follow a proper maintenance of chart, of fever chart, oxygen saturation chart, breathing pattern. And if you find something disturbed in this, say chest pain, breathlessness, or persistent fever, initial 3-4 days people generally settle down with the taking normal, maybe some antibiotic, antipyretic. Crocin is the best, paracetamol is the best drug should be taken, and with good hydration. Vitamin C can be taken in form of lemon water, or lot of taking lot of steam is also not advisable, because thereby you ultimately damage your respiratory tract, nasal mucosa, oral mucosa. It should be 3-4 times alcohol based gargles, which will reduce your viral load in the throat. And also taking not too much of steam, I would say. If you can't take steam, let it be. Not I would not advise people take all sorts of camphor and ajwain inhalation all the time. That also damages your respiratory mucosa. We want your mucosa to be intact and healing in a proper way. So I would suggest that if you have persistent fever, maybe after consult a doctor. Definitely now teleconsultation is easily available. Consult a doctor and keep a watch on your oxygen saturation and your temperature. if you find your saturation is going down, 94 is the normal parameter which you should follow, 94% saturation of oxygen, and temperature above maybe 3-4 days persisting continuously 101, 102, you should be worried about. At first go, you should not run for a lot of investigation. Basic investigation can be done, and maintenance of hydration should be done throughout. Once 3-4 days have passed and you are not still responding, or developing pain in chest, or you are developing desaturation, then it is a cause of concern. Then CT can be done. Even plain CT is good enough to tell the condition of your lungs. And then gradually, if you find that your CT is deteriorating, or then comes the need of oxygen concentrator. If you can get it from the market and still manage at home, or otherwise if saturation keeps on going down, then you should visit the hospital, and definitive treatment will start in the hospital in form of remdesivir, steroid is a very good drug, but it should never ever be taken on day 1, 2, 3. Once you see the behavior of the fever, behavior of your respiratory, that means lung involvement, then only you should go for steroid, because it may affect your fighting capacity. It ultimately may affect your immunity. So first we want your immunity to fight with it. And then if you develop the immune related damages, that is cytokine storm, we say. Every people is understanding what is cytokine storm. No, it is a basically mechanism which body develops against once the virus is there. So they may damage the lung. Then you should think of steroid is really Lakshman booty, and it is definitely a life-saving thing. Should be taken cautiously under supervision of doctor, which can be later on discussed in great detail. So I would say regarding children, those I basically tell about the children because symptoms are basically the same. We have to be more cautious. If you have some contact, you should take care of. They heal very fast with simple, bare, minimal supportive treatment. Maintenance of hydration, maintenance of temperature, and addressing the cough coryza with them. Not needed to give all sorts of antibiotics. If you find some infection, is definitely you go for antibiotic, but most of the cases, if it is clear cut uh, this COVID disease, then it settle down in children nicely. Regarding if any mother is feeding the child, definitely mother can feed the child, but with a great precaution, washing hands and putting a medical mask, that is N95 mask, so that child is not exposed, because we say the breast milk is best suited for a newborn, or maybe for infant. And pregnant mother should also take care normal precautions. They should take good hydration, antipyretics as advised, anti-fever medicine as advised by the obstetrician, and should relax. First and foremost is you should be able to fight it at your mind level. You should be uh, more calm. It is easier said than done, but you should think of how to maintain your calmness, because that's how you can fight well with the disease. You should do yoga is anyway a good practice. Deep breathing exercises are always best thing which can help your lung to carry more oxygen. So it should be a normal healthy lifestyle. It should be in everybody's lifestyle, not only during COVID, but it should be otherwise always be there. So with these comments, I would like to uh, ask my panel to take it forward.
Anu, invite the second speaker, Kanu.
Yes, sir. Thank you, ma'am, for creating the awareness among us.
Thank you.
Dr. Ujjwal Ved, CMO ILBS Hospital. Now, on behalf of Samvad, we welcome Dr. Ujjwal Ved to share some information about the COVID-19 pandemic with us. Please, sir.
Good afternoon, everybody. So I'll be just telling you, just the basic things that we are dealing. I'm dealing with COVID from, when it started in March last year. So, but this scenario is a little bit different. So I work in the emergency, right? I had the emergency in ILBS hospital. So it's not a COVID emergency basically. So we are basically a single specialty hospital, but we do get people who are already suffering from, chronic diseases and all, who are more susceptible to getting this infection, right? But if you differentiate between a COVID hospital and a non-COVID hospital, for example, what we have experienced clinically, like ours is a non-COVID hospital, right? We have a 20-bedded big emergency, but then we have patients who come in without uh, being tested for COVID, but they have some symptoms. Then we take them in, give them the primary care, test them for COVID in the emergency. Now the ratio has increased, say 80%. Out of 10, 8 people come positive, 4 are symptomatic, 4 are asymptomatic. This is the usual trend that we are experiencing from this April. Okay, so we are surrounded with people who status we don't know, and they are maybe in the emergency for say 24 hours, right? If we get an RT-PCR, suppose first we do the rapid antigen test. If it comes out to be negative, then we send the RT-PCR test, and the patient stays in the emergency till we have the report. If he comes up to be negative, then he's shifted into the respective ward or ICU isolation, or things like that. And if he comes up to be positive, then he shift him to the COVID ward or COVID ICU. So my point of telling you this story was that we are living in a very unpredictable kind of a infectious area. But touch wood, it's more than 1 year, and I still did not get the COVID infection. Somehow, I don't know. Everybody asked me, "How are you safe till now?"
Great.
So,
Great.
so I must say, 90% of my staff, including all the doctors, the nursing staff, other supportive staff, so they are affected. The people who were left out, most of them got suffered in this month of April. Even post vaccination, my colleagues who have taken 2 doses of vaccination post 15 days also, they got infected, and matlab, it took them around 15-20 days to recover. So first thing, like Ushma ma'am said, the first thing what I feel and what I observe, the people who are getting infected now, mostly they still don't wear mask. Like for example, I myself, I have stopped wearing PP kit from last Diwali. I don't wear a PP kit. I don't wear a cap. I don't wear gloves. I just wear mask. So I am wearing two masks, one N95 and one disposable surgical mask above it. So that has been my strategy, and it has worked also quite well, I believe. So people, even people who wear PPE kits and shields and all that, gloves, everything, you are covered. Still, 90% of the staff is still affected. So maybe the what I feel, the doffing area in hospital settings where you doff the PPE kits, most of the people get infection while doffing when you remove PPE kits. So there has to be a proper method of how to wear and how to dispose. So most people who wear PPE kits, they are saved while they are working, but while they are disposing their PP kits, that is the most dangerous time and the period, when people get infected. So but these things actually, they have to be handled at personal level. Everybody knows that you have to wear a mask, you have to wear face shield or protect your eyes, but then you have to, uh, do that religiously. Just doing it for formality's sake. Like say, for example, I'm wearing spectacles. Okay. So if I'm wearing a mask N95, my point is I'm just focusing on how to protect yourself, just the basics. Okay. Suppose you're wearing an N95 mask which has a some sun nose strip support, and so what you should do, you can see me, once you are wearing a mask, just fix that strip along your skin. Okay. And how to check that whether it is leaking or not? One thing is, you get some steam kind of a thing which blurs your spectacles. That should not be there. And if you think that you are not able to wear it properly, put a tape here, fix it with a tape, because this is the area where you will inhale, and the the aerosols, they will go back and they can infect your eyes, and that it, all the mucosal membranes, the nose, mouth, eyes, these are the potential sources from where you can actually get infected, right? So this is one thing. Hand washing, like ma'am said, that is most important. Whatever you do, gloves, I'm not in favor of wearing gloves. You wash your hands frequently. If you will wear gloves, you will be carrying infection from one place to another. So I find wearing gloves as more dangerous thing than not wearing. While you're working on a patient, it's a separate thing. You go to a patient, you're putting a cannula, you're examining, that is a separate thing. That time you can wear and you dispose the gloves. But then you are wearing one gloves, you're writing also in the files, then same gloves you are going to the patient also. So these are very small things, but like I've seen people who are not working in hospitals. Suppose somebody is in Delhi University campus, say for example, in some this record room or somewhere where you're working with files and everything. So I see people wearing masks, gloves, and touching all the files, taking away all the material. So basically they are taking infection from everywhere, and they are keeping it with themselves in the gloves. So I am not into that. It's better you go wherever you go, use a alcohol based sanitizer, wash your hands properly. But the uh, still the route that will protect you is a good mask. If you don't have a N95 mask, wear two surgical masks. This we have seen works very appropriately. Cotton mask that people are wearing, it will just prevent you from dust. It will not save you from any kind of virus. So whenever you are going out, make sure you are wearing at least two surgical masks. Okay, either 195 and one surgical mask. So focus on mask first. That is one thing. And okay, like one more thing I would like to tell, that now there is a bit question about when to do HRCT chest, or how to rate what is CT severity score, what is CT corads. So just to tell the basics, CT severity score, it you can divide both the lungs in five lobes. Okay, so what CT does, it sees how much of, suppose there are five divisions. Okay, we divide the right lung into three lobes: upper lobe, middle lobe, lower lobe, and the left lung into two lobes, mostly upper and lower. So we have five divisions in two lungs. So we have divided the amount of involvement in those particular lobes, and while we calculate those involvement in particular lobes, that's how we give rating, whether say it is 5% to 20% involvement is there, so we will give one scoring. So similarly, if uh, the involvement is more than 5%, 5% to 24% in one particular lobe, so we give a score of 2. So it similarly it increases to score 5, wherein your 75% to 100% lobe is involved, right? So this way we measure the involvement of lung involvement in all the five scores, and that's how the CT score is taken out. Okay, so CT score once comes to, the total score can be divided into three major parts. One is mild, moderate, and severe. Mild is generally below 10, and then severe, moderate, you can, some people consider it up to 15 to 18, somewhere like that. Okay, but just score per se is not anything. Okay, what is happening is, even people who are getting RT-PCR test done, it is coming out to be negative, but their CT score comes out to be 15 out of 25. So now what the new guidelines are, you don't have to rely only on the RT-PCR reports. Even if your RT-PCR report comes up to be negative, but your CT scoring is showing some involvement, so you consider that patient and positive. Plus the RT-PCR report that we are saying negative, that could be false negative also. We have seen people, who come to us with same day report, like, sir, we have a report, it is RT-PCR negative, done today. What I feel is, one major reason of reports coming negative in a symptomatic patient is that the people who are taking samples, they don't take the sample properly. That is one of the major things where people also don't realize. Because see, there are two swabs you have to take. If you can see my face, so laterally, if you see, you put one that nasal cannula So from this swab, and it has to go till this posterior pharyngeal wall. Okay, so it has to go this deep. So in ILBS where we do the testing, na, we have pasted one this side picture of like a human face with a cannula, and it shows that this will be inserted till this. So kindly cooperate. If you just put it here in the nose, so it has high chances of giving, false negative report. First thing. So first you take the proper sample from nose. Second is when you're taking the sample from mouth, it should also take a adequate quantity of sample from the posterior pharyngeal wall. Okay, just not brushing the tongue and taking out. So these are, I think, major factors. Just like you find symptomatic people having RT-PCR negative report. And what else is left? Regarding steroids, what I'm seeing that people are prescribing, like if somebody is detected positive, so immediately they are starting with take Medrol. Now Medrol is short in market. So steroids are not indicated in all the positive patients. Like Ushma ma'am very rightly said, first 3 days forget it. We take it. We don't give for first 5 days at least, because they see what steroid will do. It will decrease the inflammation that is there in the lungs due to this viral infection, and generally the inflammation takes place after 4 5 days only. Okay, and initially if you start steroids on the day one, so it will actually do more damage than doing good. So it will increase the chances of super added infections. Now you're suffering only with virus. If you start with steroids early, so you might land up having other superimposed bacterial infections also. Okay, then you can correlate these CT reports and RT-PCR reports with some specific inflammatory markers. Like what we are relying on is CRP is a good marker, C-reactive protein, and there are other interleukin 6 is there. Then D dimer is very important. What I feel to start with antithrombotics. So I think D dimer is a main marker. You must see the clinical history of the patient. See, actually, treatment will depend from individual to individual. Same treatment cannot be prescribed to everyone. Like people are now starting with this Eliquis tablet. One person told that my doctor told to take me Eliquis. Now everybody is taking Eliquis. So it's not like that, na. So this miscommunication is there. Plus
And I
WhatsApp.
would add here the serum ferritin is also a very good marker,
Yes,
and
yes, yes.
CRP in a serial manner. Actually, CRP
Done in every 2 3
yeah,
days.
yeah,
So that's very important. Ferritin is very important. Then
yeah,
LDH you can do, but the D dimer will decide whether you want to
yeah.
take any antithrombotic or not. Plus whether you have any prior bleeding history or not. People are there with who have some cardiac stents in situ, or they might be taking some already blood thinner. Some people are taking heparins or things like that. So you have to see APTT is that you have to see the coagulation profile basically. Matlab just per se you cannot do that. Somebody might bleed. Somebody has a tendency usko you are giving, people are giving ecosprin also like that, without any logic. So they might land up having brain hemorrhage or stroke. So
Here, I would like to add that steam. Uh, I read an article. People are using steam right, left, and center, thinking that steam will kill the virus. No, it will rather damage your vasculature, your membranes, and thereby it will initiate your thromboembolic conditions more.
absolutely right, absolutely right. So just focusing on the steam, but everything has to be taken with a logic. Don't just go blindly with this, right? And what else we can tell you? Like, okay, uh, now the question was whether to give this Fabiflu or not. Now there it is also kind of, you can say, a trial drug also. The latest that treatment protocol that AIMS has published on 3rd of May, it does not give Favipir in its treatment protocol, even in the moderate disease. But now what is happening is on day one, Favipir is being started. I have I have handled many COVID patients, but most of them recovered without taking any antiviral drug. So I feel it's not a mandate that you start immediately with antivirals also. First, you should go with the vitals, monitor SpO2. check patient's history, monitor vitals, temperature, hydrate yourself well. These things, the general immunity things will work. Right away going just running after the drugs like remdesivir, I mean, these are all trial drugs. Now people are running with these anti monoclonal antibodies, this tocilizumab and all these anti-cancer drugs. So these are all are trial drugs basically. So there has not been any proven efficacy, or how many people have survived after taking tocilizumab, right? So we have to see everything. Just don't rush. Many 80% of the things can be managed at home. If some saturation is being dropped, you check it twice in some other finger, warm your extremities. If your peripheries are cold, it might give a false, low saturation, low SpO2. And even if you're maintaining saturation above 90, your vitals are okay, your blood pressure is fine, you're hydrating well, you're urinating well, you're passing stool properly, no vomiting, nothing like that. So I think above 90 is also acceptable, always when you feel there is a drop in SpO2. So what I tell my people whom I deal with, just do like this. Maybe close your fist and open, or rub your hands like this, warm your extremities. You must see, because आजकल everybody is using fans, ACs, so your fingers tend to be cold, right? So first you make sure that you have enough. A new protocol is walk for 10-15 minutes and then check SpO2, so that your body is warm enough and your peripheries have good circulation. So then you should see SpO2 and then confirm. Just not see one reading, oh, it's coming 90 and run to the hospital. So it doesn't work that way actually. This is creating a panic. Things like this are creating a panic. The people are not being logical enough, you know? So the needful are not getting the bed. Plus, then okay, the data that has been available. So vitamin C you can take at a certain level. Just don't keep eating vitamin C. Also, then it can cause acute kidney injury. It affects kidney also too much of vitamin C, also not that good. You can take some multivitamins with the zinc. Then in the Indian population, we generally tend to have low vitamin D3 levels because we are not exposed to sun much. So vitamin D3 is also indicated. You can take it once in a week in adults. And regarding the kids, ma'am, I would say that most of the kids who are vaccinated as per the schedule, so they are doing good.
Yeah.
Like I have seen most of the families who got affected. So I told them not to get your kids tested. Just consider them that they are already affected. Give them some
Yeah,
multivitamin
even
with the
I have
zinc in it.
treated them on empirical basis, on just a telephonic consultation, and they did well.
Yes, yes, yes. So there has not been any mortality reported as such. And what we did was experimentally last year, one study was there from Australia, which showed that BCG vaccination had some good role.
Yeah.
But it was not circulated much because BCG is a very cheap vaccination. 50-60 rupees, you will get 1 ml of vaccine. And what was indicated in that study was one adult was supposed to take, I think, point 0.1. So that 160 rupees vaccine you can give to 10 adults.
Yeah, yeah.
So we took it in our family, and we are doing well. Maybe it was experimental only, but similar thing is with kids also. So they are already vaccinated with
They're
BCG.
already vaccinated.
Somewhere it has a role also, ma'am, I believe. So the kids are doing good, I believe. No, I have not seen any kid, developing any unless they
So
are already suffering from
alarming
ARDS or
signs
something
are
like that.
same in children, those who have respiratory issue, because there is a macrophage activating system. There is the immune modulation system, immunity hyperreactivity. So you have to keep a watchful on serum ferritin level with children who are doing bad, means who are actually having high grade fever, and they actually pass into toxic shock syndrome and all those kind of things which need hospitalization and management. So, but they are very few.
Yeah, very few cases are reported like that. Plus, the home remedies you can take, like everybody is showing on TV also, how to improve your oxygen saturation, lie down in a proning position. These things are being practiced in hospitals as well. We have patients who are intubated on ventilator. Still, what we do is we try to put them on proning position. Like
Prone
you have to
ventilation.
lie on your tummy. But if you are able to maintain with that, so we continue patients on ventilator also in proning position.
Actually, it is DER, everybody is scared कि मैं मर जाऊंगा. So that is the reason people are just कि कुछ आ गया है, मर ही जाएंगे.
But it's not like that. But steroids in inhalation form, जिनका पहले से people who have asthmatic history or any COPD history or old age people, something like that. So even budesonide, normal, just nebulize with Budecort. You don't have to take oral steroids also. So I think inhalation form in a way of nebulization with just steroid twice in a day, that works really well. Rather than going for
it's actually acting on the lung only directly, anti-inflammatory.
So it has that anti-inflammatory role also. I think it works really well. Plus, in susceptible people who have that tendency of going to into this ARDS or something, you can of course think of adding some bronchodilator, in which if your lungs arterioles are shrunk, so they will open up and they will help in a proper ventilation in lungs. So I think these are the basic things that we need to see.
And children mainly present with the gut related disorders.
Yes.
They present with vomiting,
Yes, ma'am.
appendicitis like abdominal pain, loose motions. So these are the very common symptoms in children. So you should be very suspicious of this disease when you find these symptoms in children.
Yes, and another thing what we have seen is if your saturation level falls below 94 or below 90, so the recommended drugs right now are you have to take steroids in IV form, and they are working really well. Those are the times when you should go for IV steroids. Methylprednisolone is the choice of drug right now, and dexamethasone is another option if you don't find methylprednisolone. So dexamethasone is also giving equally good results in that. So plus this, and azithromycin was being given like every pharmacist was also given, but I think its role is a little bit controversial.
Only antibiotic kind of thing.
A little bit controversial because we have seen in some people who are suffering from some previous cardiac issues, so they developed arrhythmias after taking azithromycin. So azithromycin, I think blindly people should not take. We should not promote ki kuch bhi hua, start with AG. So don't do that. Doxycycline is a better drug which is giving a better response, right, in COVID confirmed cases. Plus, if there is some suspicion of lung involvement, so then that can be, of course, taken care with some, higher this antibacterial antibiotics that we can.
डॉक्टर साहब मैं एक इंटरवेंशन कर रहा हूँ, ये डॉक्सीसाइक्लिन क्या हमें डे 1 से स्टार्ट कर देनी चाहिए इवन इफ वी हैव ए माइल्ड फीवर और no positive report yet?
Sir, it will depend on your clinical history, what symptoms you are having. Just having fever, so it does not indicate starting antibiotic.
That's right. Yeah.
Also, if you start on day 1 just with the antibiotics,
not a good idea. Yes.
So first see for whether you have any associated symptoms, any sore throat is there, any cough is there, any breathing difficulty is there, or you have any previous history. So just right away starting from day 1 with an antibiotic, I don't think that is a
because
good
some
recommendation.
doctors I have seen that they immediately write you erythromycin, doxycycline, vitamin C, this, that, so many list, and you start.
Vitamin C, zinc, and all these things. Some anti-allergics you can take, some Ilicos, levocetirizine, things like that you can take. But mostly the cytokine rush that comes after 7 to 10 days.
7 to 10 days. Yes.
So that is the time when you can consider giving these antibiotics.
I think most of the people who are suffering these days, even youngsters, they are not going to the doctor immediately. Rather, they are taking the medicine themselves, taking from a chemist or somewhere else, and start it. And that creates a more problem because your immunity goes down once you start with antibiotics and all that, and then your problem of facing the COVID becomes little susceptible. Even I have seen that the doctors are recommending antiviral drugs from day 1.
Yes, that's what I'm saying. I don't think that it is in no protocol. It is there. AIMS has given the latest protocol on 3rd of May. Favipiravir is nowhere in the protocol. Remdesivir is also not there. But yes, in hospitalized patients, maybe So who are it's basically an immunomodulator drug, remdesivir. So generally it is given on day 7, not on day 1. from starting of the symptoms, because that is the time when you have that highest level of cytokine rush. So these immunomodulators, they help to control those things.
Even plasma therapy is indicated quietly. That is also controversial.
LBS, we are having the plasma bank, so we have like plasma requests coming from all Delhi NCR. At least 20 people call me every day, plasma dilwa do. We don't have a donor. But the thing is, its role is also controversial. How
Controversy.
many people have survived after taking plasma? है ना? So basically, it is a panic that has been created. So its use should be judicial. And ठीक है, in very critical patients, these drugs are basically hit and trial, sir.
Yes.
So sure shot guarantee you will take
कुछ नहीं
2
है.
unit plasma and then you will be okay, or you're taking 6 doses of remdesivir, you will be
नहीं,
okay.
प्लाज्मा तो पॉपुलर हुआ जब जैन साहब ठीक हो गए प्लाज्मा लेने से, तो दिल्ली के हेल्थ मिनिस्टर, तो प्लाज्मा लोगों ने लेना शुरू कर दिया.
बट
कुछ लोगों में
इनफैक्ट
ठीक है.
आईसीएमआर की स्टडी आई थी जिसमें आईसीएमआर कहा था कि देयर इज नो प्रूवन बेनिफिट ऑफ.
That's right. That's right, sir. That's right. डॉक्टर साहब, यही बेसिक प्रॉब्लम ये है एजुकेशन की, कि कुछ तो डॉक्टर्स की भी, जो मैं कह रहा हूँ, एजुकेशन की जरूरत है. जो कॉमन डॉक्टर्स हैं, प्रोफेशनल्स, जो एक्सपर्ट्स हैं, वो तो जब जानते हैं. दूसरा, लोगों में जानकारी की कमी, उससे जो है काफी डैमेज हो रहा है, क्योंकि हम शुरू में ही बहुत सारे एक्शंस करते हैं जिससे हमारा डेटोरेशन हो जाता है, और जब 7 ये ज्यादा डेटोरेशन होता है, तब वो फिर दवाइयां जो सही है वो काम नहीं करती हैं. तो दिस इज द बेसिक क्रक्स व्हिच आई कुड गैदर.
Absolutely, sir. Absolutely right.
So let us,
Yeah. Thank you, sir. Thank you very much for sharing the knowledge with us. I hope we all can keep ourselves guarded.
Thank you.
Now, Dr. Dinesh, Senior Director Radiation Oncology at Max Super Specialty Hospital, Vaishali, treat cancer patients and presently managing them in COVID times. We welcome our chief guest, Dr. Dinesh, to share the details of the second wave of COVID-19 pandemic with us. Please, sir.
Thank you very much for this very excellent panel discussion which we are having. In fact, we have gone through so much of technical issues. So I will just briefly discuss about the technical issue of COVID and a combination of cancer patients. So if anybody is having a symptom of having cancer, that should not be delayed, and the diagnosis should be done, because otherwise the cancer will progress. And those who are undergoing treatment, like they due to undergo surgery, we always perform a COVID test before we take up them for surgery. Those who are undergoing radiation or chemo, if they develop COVID, then we interrupt this treatment. We wait for their recovery from COVID, then give them a week or 10 days to recover, and then restart their radiation or chemo. Those in the follow-up, they can, in those patients, we are encouraging video consultation for any of their issues. So this much is, and we cannot undermine the cancer problem or the cancer treatment because the COVID is going on. They both have to be managed and judiciously managed. I was listening to all the discussions today. So I would like to discuss something more than the technical issues. It is more about our lifestyle and the social aspects of COVID, and we as a part of the society. As Principal Sir said right in the beginning, having one's own good health is a it's very important to prevent oneself from getting COVID. What happens, suppose 3 or 4 persons, they get exposed to viruses, same virus load affects 3 or 4 persons. All of them will not catch COVID. The ones which are in good physical health, they will be able to overcome that infection. It will not happen. So what is important is that we take care of our general health, and with general health, majority of persons have realized in this time that the health of lungs and health of heart is much, much more important than the health of muscles. In most of the gyms, or rather in all the gyms, main emphasis is put on the muscle building. Cardiac and pulmonary exercises are also being there, but they are not given that much of importance. So we need to work very hard on our lungs and the heart. One more thing which is very important is obesity. Many studies, both Indian and international, they have proven beyond doubt that COVID and obesity as a combination is a very bad combination, because the outcome is not that good in these patients who are obese. In obesity also gets affected with diseases like hypertension and diabetes. So we need to take care of our health in general. For that, I think a good balanced diet with a good mix of proteins with the other nutrients is important. We should be focusing more onto the natural ingredients rather than going for the market preparation. I have seen very market preparations of proteins which are specially available from the gyms. They are having steroids incorporated in them. And on the boxes, you can see that it is written for sale outside USA. They are made in USA, but they are writing for sale outside USA because US FDA is not approving that product. And Indian FDA is not going into those details. So we should be going for more of natural proteins and natural diet and a good health with a good taking a control on your weight. Another thing which I would like to highlight in these times, that we look up to the youngsters to make help groups, and these help groups can be made at the RWA levels. In every locality, there are many COVID patients. There are families in which the entire family is COVID positive. I am seeing that many people are doing that. But youngsters, because they are very tech savvy, they are very resourceful, they have got very good connections. So they can spearhead, and IT and artificial intelligence, it also will come up later on. But then going into this direction, like many people, they need day-to-day utilities, they are not able to go out, they can be helped. Then food is a very important part. Many families, everybody is sick, they are not able to make food. So a good healthy food to be prepared and to be offered to them, that is important. Then available of resources, let us say ambulances are required, or which hospital is having vacant beds, that is important. So to have this information, nowadays WhatsApp, Facebook, they are all flooded with so much of information, and majority of that, 90% of that is fake information, or that information is 2 to 3 days old, and the situation changes every hour. So if these community help groups, they are able to make these informations available, like many patients are not able to get bed in the hospital, they are not able to get oxygen. So if basic oxygen is made available till the bed is available, so that is a very big help to them. But majority, they do not know from where to get the cylinder. So much of black marketing is going on, so much of hoarding is going on, availability of medicines, making them available to these families. So this becomes a very big thing. Another very important thing is to take care of their mental health. Families, they feel isolated, that we are living in a group housing society. They have told that our maid cannot come and work because you are COVID, because there is no one else to help them. So can something be done to provide them clothes or water or this food or any medicines and those things which can be helpful to them, and also talking to them on telephone, so that their mental health, and they know that there is somebody which they can contact in the need of hours. Oxygen concentrators are available, but majority of oxygen concentrators in the market, they are of poor quality, they do not meet the standards, and they are being sold at exorbitant prices. So doing some sort of this R&D into these oxygen concentrators, what are they, how do they work, and which is the appropriate one for which kind of persons, making this information available, and maybe keeping a facility of 4 or 5 beds available in your locality, so that when the person is waiting to get admitted in a hospital, he is not getting a hospital bed, that few hours or 1 or 2 days can be tied over with these facilities, can be taken care of. Once again, like properly wearing an N95 mask or wearing 2 surgical masks is most important in preventing spread of the infection. So, and third wave is going to come. We cannot be complacent, and this should be taken as a learning. We should come together as a community, and oxygen concentrators are now being manufactured in India. I have seen that there are companies which are making oxygen concentrators for the hospitals also, and gradually we will see that majority of hospitals, they will come up with their own oxygen concentrators. But if we look at the economic side of it, till now, why hospitals were not having oxygen concentrators with them? Why they were dependent upon the external sources? Because the difference in cost of making an oxygen concentrator and also to keep running it, the HR cost along with that, and the cost of the infrastructure, the cost of maintenance, all that is going to be added, and all these costs eventually gets passed on to the patients. So this is going to make healthcare more and more costly and costly. Even in present days, what is happening, that small nursing homes, they are going out of business, not in present times but earlier, because so many of formalities and regulations have been put up by the governments in place, that to meet them it becomes very expensive, and the patients are not willing to pay good money to small nursing homes. They say, if we are having good money, we'll go to Max, Apollo and Fortis hospital. Why should we take treatment in a nursing home? So many of my friends' nursing homes have closed down, and the big hospital chains, they are being purchased by the private equity groups, like the Max chain has been purchased by an American private equity group called KKR. So they are all having different economic dimensions. We as a society, we have to come together to provide good viable solutions so a common man can get good healthcare facilities and at affordable cost. So as was told right in the beginning by Bhavna, that this should be also taken as an opportunity. Healthcare is going to undergo a lot of transformation after this. It has been undergoing. Government is not going to spend very heavily on healthcare, hardly 2 or 3% of the budget. I think we as a society has a big role in coming together, understanding the healthcare and understanding how we as a society, and especially the youngsters, they've got a very big role to play into this and to helping the society and the healthcare sector to provide good, affordable health to majority of our people. Now, a very big worry which is coming up is now the infection is reaching the rural areas. They are practically not having any infrastructure. It is going to be very difficult in rural areas, and let us pray that it doesn't spread there much. And by their own immunity and by their open air spaces, they are able to get saved of this. I think the technical, if other questions we can take up now with these comments. Thank you very much. Thank you, everyone.
Ujjwal sir, you want to add something, please?
Yes, just 2 more minutes, है ना? I will just tell you about the clinical what we are doing actually practically क्या कर रहे हैं, ठीक है? Like sir asked me, Agarwal sir, कि whether we should start with the antibiotics or not, और ये सब चीज. What अभी nowadays what the scenario is, do not rely on RT-PCR or such reports, ठीक है? First thing is rely on blood test, go for CRP, D-dimer, ठीक है? And अगर any symptom is there, go for a CT test, because X-ray also sometimes does not pick up, there's the small opacities ये जो आ रही हैं आजकल, ground glass opacities
But
are
do
there.
you think that should be done at the initial stage? Don't you think that should be done only after 4 or 5 days?
Why 4 or 5 days? How do you know? Some people might not be having symptoms. Some people might be having some loose motion, diarrhea. It's not necessary that you will have some respiratory symptoms only, no, sir. And some people are
So we
asymptomatic
cannot
also.
decide the day one, which is the day one. We cannot decide sometimes as a patient.
How are you deciding day one? Because
I
many
think by
people
the
are.
onset of any symptoms, usually we call that as the day one.
Yes.
But what about asymptomatic people then?
Asymptomatic, we cannot decide which day it is.
But they could be infectious to other people if they are
Yes,
living in
they
a
are.
same household, right?
They
So
are.
what I feel is, if you go practically, go for blood test, go for CBC. That way you can see TLC count. Generally in viral infections, the TLC count is lower than the normal values.
Yes.
Go for CRP. CRP is, I think, one of the most important markers right now. And go for D-dimer test. These three things are most important, what I feel, and go for HRCT test. And like sir was asking this question, whether to start antibiotics or not. If you have any such symptom, I said, if you have just one episode of fever, don't go for antibiotic. But if you have any suspicion, anything relating to this, start with doxycycline. It has a proven role now.
Right.
Go for doxycycline. All the adults, you can start with 100 mg twice in a day for 5 days. Plus prophylactically, we were initially giving ivermectin tablet 12 mg. The
Right.
initial dose for prophylaxis was last year. It was for day 1, day 7, and day 30. Now what we are doing is, we are giving it for 3 days at least, once
Continuously.
in a day, regularly for 3 days.
4 mg.
12 mg.
12 mg.
12 mg in a day.
Once in a day for 3 days. You consider
One
this.
tablet once a day for 3 days.
Yes, so you consider this as a prophylaxis until you are proven with reports. So my point is, consider blood reports and CT scan as more reliable parameters for considering whether you are infected with COVID or not, rather than running for this RT-PCR test or rapid antigen test. One thing. And regarding this antiviral drug, what we are, my wife is also working in a COVID hospital. So she was sharing her knowledge, experience with me. So regarding this antiviral favipiravir, although it is not there in the in schedule, but if you have a proven suspicion, strong suspicion with HRCT chest or high CRP or high D-dimer, now people are deteriorating very fast, right?
Yes.
So if you start with the clinical evidence, with some blood reports, with a CT report maybe, which shows that you are under this high suspicion category of this, it is better to start with this favipiravir. The actual dose is for 14 days,
Yes.
but the current scenario is, you take it for at least 10 days. It really helps in shedding the viral load. But it just not with the fever, you start flu. Do some initial blood testing, do CRP, do CBC, do D-dimer, or do HRCT test. If there is any evidence in any blood report or in the diagnostic imaging, then you are a potential candidate to start with
Yeah,
favipiravir. There is no harm.
I would say RT-PCR should be done initially, because in 80 to 85% it is positive.
No,
The
we
dilemma
are
is
seeing
only in
patients.
20% in which it is not positive.
You might have seen patients who are responding well to PCR. I have seen patients who are getting a score of 15, 18, even 19
So
score in
definitely,
HRCT.
I'm not
They
saying
are still coming negative
no
in
to
RT-PCR.
HRCT, but HRCT is also indicated in later part. Once it will not be done
Lot
up.
of controversy on doing HRCT
HRCT
because
is always
Should be done.
he also said that it's
Should be
a
done when required.
yes.
because initially you won't find if you do HRCT on day 1, day 2.
But I agree with one thing, I definitely, substantiate that, because in our case, we have seen in my mother-in-law's, she's 74, that, after 7 days, when she's the oxygen level start falling, CT immediately helped, and we could start the
Later part. It
yes,
won't
later
help
part.
you in the
No,
first
not
part.
initially. Yeah, yeah.
It has to be
Yeah.
done in the later
Rather,
part.
initially, doctor made a mistake that he did chest X-ray and started with antibiotic, which was again a, because she was in a village, so
It's not a very
I could
sensitive.
intervene. Yeah, I could intervene and got the things done, and then she
Chest
recovered.
X-ray is not a very sensitive tool actually.
Right.
HRCT is sensitive, but that too in the later part, once the cytokine storm has actually set in and causing the damage.
Yeah. All right. Questions from audience, from students,
So firstly, I would like to thank Dinesh sir. Thank you so much for such information and kind words and making us aware of the right facts that we need to understand in such situations. Now, I would like to request everyone if
Yes,
anyone has any questions,
may I please go with my question?
Yeah, please.
Yeah, this is Dr. Anjali. I'm a assistant professor at Ramanujan College, Department of Economics. I would like to thank all the doctors for being so informative about the situation right now. And one simple thought came to my mind, that you people have listed a series of tests in order to diagnose the case. If a person is not accessible to these tests, what is that one test that you will prescribe for them?
CRP.
अगर कोई accessible ही नहीं है, मतलब ऐसी जगह रहते हैं जहां पर जाने का मौका ही नहीं है टेस्ट कराने का, तो उनके लिए आप एक टेस्ट कौन सा प्रिस्क्राइब करेंगे?
CRP मैम, फॉर मी इट्स CRP.
पर अगर एक टेस्ट होगा, अगर ब्लड सैंपल ले रहे हैं तो सारे ही ब्लड टेस्ट हो जाएंगे.
अच्छा डॉक्टर, right. So those people, why I asked this question was that I had few people around me, and the cases which came around was that the correct medical access was not present to them. Okay. So घर में कोई ऐसा indication, so we can see the symptoms, but they are so nascent that one doesn't come to know. अगर accessibility नहीं है, तो उस केस में क्या करना चाहिए?
आई थिंक प्रिज्यूम करना होगा कि कोविड है और फिर सिम्टम के बेसिस पर ट्रीट करना होगा, और अगर लगता है प्रॉब्लम है तो फिर असेस करना ही पड़ेगा, हॉस्पिटल का कुछ ना कुछ करना ही पड़ेगा. फिर आप होम केयर में नहीं रख सकते अगर सिचुएशन ठीक नहीं हो रही है तो.
डॉक्टर साहब, जैसे आपने बताया कि आफ्टर 2-3 days ही जाकर you come to know actually what is happening to you, then how does one monitor these 2-3 days? What should be the basic criteria for monitoring? Yeah.
Exposure, after exposure, it is said 14 days, 5 to 14 days, but precisely it is 5 to 6 days, 7 days you start getting the symptom. So day one is when you get the symptom, whatever it may be. It may be throat pain, throat irritation, congestion, loose motion, pain, abdomen. If you have any of these symptoms and supposedly exposure, nowadays air is full of it. So we consider that once you have stepped out of house, you are exposed to this deadly virus. So definitely it is not possible to have contact tracing all the time. So I would suggest go for RT-PCR, because still I say it is positive in 80% of cases.
I see.
Problem is in those 20% with the symptoms.
Okay.
When you cannot prove with RT-PCR, then you go for rest of the test. And if the condition is deteriorating, these are the markers, CRP, LDH, serum ferritin, all those liver functions, monitoring of saturation. These are all the things which are to be serially done later on.
Okay. Thank you, Dr. Ushma. One more question, if I'm allowed to go ahead with that. Yeah. So, there is a lot of ambiguity around the vaccine. Yeah. The popular belief is that आप पहले करा लीजिए, देखें क्या होता है आपके साथ, फिर हम कराएंगे, right?
हमने करा ली है, अपने पेरेंट्स को भी करवा दी है.
अच्छा.
Dr. Anjali, I took it on day 1, 16th of January. 18 से हमारा सेमेस्टर था FMS का. 17th I was lying down with fever, but I took it on the very first day.
See, there is no way we can get herd immunity. Getting herd immunity through infections will be devastating for the society. So best way is vaccination, like in polio. एक बूंद है जरूरी. वैसे ही it is the same way vaccination should be done once it is available. And believe me, very few cases, one in 1 million cases are having some problem because of some underlying issues. Otherwise, it is safe. It just causes mild discomfort at the local site and maybe a mild fever, which can be taken care of with paracetamol medicine only. So do not worry and take it.
और दोनों वैक्सीन अच्छी हैं, जिस पर भी आपको एक्सेस मिल जाए वो लगवा लेनी चाहिए.
Definitely. Third one is coming, so you can go for that also.
अच्छा डॉक्टर उष्मा, एक और कंसर्न है that the wave is still peaking. We don't know when it will peak. है ना? It is still shooting.
Yeah.
So people are kind of scared also, that what you were saying earlier, कि पहले थोड़ा settle हो जाए wave, then we will expose ourselves. Means बाहर जाने में भी तो exposure है, तो थोड़ा settle हो जाए तो फिर जाकर वैक्सीन करा लेंगे.
Yeah, definitely there is big debate because once you are going out, you can definitely get exposed to the virus, and there are cases which once they stepped out of house and brought back the COVID. But this cannot be an excuse, because once you get vaccinated, your immune system will start acting against it. So definitely with a good mask, go out and get vaccinated. If government is actually planning, if they can start with door-to-door vaccination, because that will be a very good idea. But till now, because of lack of vaccines, first shortage of vaccines, and secondly personnel, they have to be technically sound person who go out and do the vaccine at home. So this is being considered, but right now it is not there. It is in the pipeline only.
और डॉक्टर उज्जवल ने ऑलरेडी स्ट्रेस अपॉन किया था, अगर आपने N95 मास्क अच्छे से फिटेड पहना है या N95 नहीं है तो आपने सर्जिकल मास्क 2 या 3 लगा रखे हैं, प्रॉपर फिटेड हैं, then you are protected. So go and get the vaccine.
Okay, sir.
No need to be scared at all. No need to be scared.
Thank you. Thank you.
Ma'am, I do have one question. And sir,
yeah,
after how much time should we vaccine our second dose if we get COVID after first dose?
It is usually 4 to 6 weeks, maybe up to 8 weeks, not before 4 weeks, after you recover from the COVID.
Okay, sir. Thank you.
I would like to ask one question. My mother was not in the age limit before she got COVID. Now she recently was isolated for 15 days, and so now it's the vaccination part. So how much weeks should we wait for before she can get vaccinated?
6 weeks will be
Is there
advisable.
such a time?
6 weeks.
Okay, so she needs to get vaccinated after 6 weeks.
Yeah, that will be a good time.
And okay, and there's one more question in the chat box from Saurabh. Can you suggest some home remedies to protect ourselves from COVID-19?
Mask. Mask.
Someone
Eat well, sir. Eat well. Eat well and hydrate well.
और दूसरा ये कि अपना लंग कैपेसिटी को इंक्रीज करने के लिए यू नीड टू डू ब्रीदिंग एक्सरसाइजेस, होल्डिंग एक्सरसाइजेस, pranayam. They are going to definitely help.
And in fact, if you are doing your lung exercises daily, you will know what time your breath holding is, and it is one of the guide which can tell you that something is going wrong at your lung level. I mean to say, if your breath holding is say 15 seconds and it has come down to maybe 12 or 10, so you can know by yourself that something is going on in your lung. So it is an indicator for that also.
So pranayam is an excellent method to practice all the time, not only during COVID, but once we are through with COVID, then should be continued forever.
Good evening, doctors. Thank you so much. I have also one question. Like, if we have a mild fever or like any symptom of corona, but I'm tested negative, then will we take vaccination or no?
Any symptoms of COVID and the RT-PCR can be negative in 20 to 50% of patients. So treat this as COVID infection. And if symptoms increase, you need to get retested. And vaccination you can delay for up to 4 to 6 weeks after recovering from there.
Okay, thank you so much.
So basic guideline is any viral infection. It may be any viral infection, or any live attenuated vaccination, the gap for vaccination will be 4 to 6 weeks. By that time, your immunity is recuperating, and then only it will be able to process the vaccine that has been administered.
Ma'am, what if I get vaccinated during COVID-19 if I'm not aware of that I have COVID or not?
Nothing can be done. It may not be that effective because your immunity is already being taken by this virus. Virus actually affects through your immunity. It overpowers your immunity. It will jeopardize your immunity. So what we are going to do by vaccination is improving your immunity, which is taken ransom by other virus. So definitely it may be not that effective.
And take the second dose after 4 to 6 weeks.
Okay. Sir, can a pregnant female get vaccinated? I mean, there is a lot of chaos.
Not
No,
recommended till
definitely
now.
no.
Not recommended. All over the world, not recommended.
Pregnant and lactating, both are not
Yeah,
in the
lactate.
schedule.
Okay, so there is a one more question. So how much can we rely on rapid test? I mean, rat test.
If it is positive,
70%.
then you can rely. If it's negative, don't rely.
Yeah.
Okay.
Achha, there is one question in chat box. Is there chance of getting infection once you are vaccinated? Yes. Also have corona. Yes. In both the situation, you can get infection. It may be a milder form, and
It can be a different strain, so you have to
Different.
maintain your guard against the COVID. Even if you are vaccinated, even if you have got corona, you have to keep your guard on
Yeah.
all the time.
I have seen both the situations.
Yeah.
That he has asked. I have seen both the situations coming positive.
No, I got vaccinated for the 2 shots, and then I got COVID. Now I am recovering actually.
And so one more, can we have vitamin C tablets on a regular basis? Like we are hearing from lots of TV news and all that vitamin C is deficiency.
Overload
occurs.
yourself. You can take one tablet once in a day. That's okay. It's water soluble, so the body that requires the portion that will keep it, and the other will come out in urine. So water soluble vitamin, generally it's safe, but do not overdose yourself. One tablet once in a day is okay.
Okay, thanks.
There's a one more question. I was positive. I'm now negative. I was positive 20 days ago, and there are some rumors that I will not be positive for 3 months now or something, 3 or 4 months. Is that true?
No, absolutely not.
There is no safe period in between. Reinfection can happen anytime.
Okay.
We have seen that
Thank you.
also.
So mask
Thank
is the only answer. Mask is the only answer.
There can be prolonged infections which can continue for up to a month, 2 months, and there can be infection-free period which is variable, and reinfections can be there.
And that is known as a long COVID.
One patient was admitted in ILBS and he tested positive for 60 days record.
But do you believe the 60 days positive day? It's basically lying down the remnant.
Yes, it could be dead virus, but then he did not test it negative, so we did not discharge also.
Yeah, you can't say the liveness or non-live. Yeah.
But
These
now
are all
ICMR says that you don't need to repeat RT-PCR before discharge.
Against this. This is because the government does not have enough resources, and
Yes.
it is just an eyewash to stop testing. Why you are stop testing? Whether this is, I'm totally against this. It's not a good I think decision.
It is lack of resources.
Yes, sir.
Is there any restriction to food supplements or nutrients that COVID patients should not have?
It's not about COVID patients. What I would suggest personally, do not go for these preparations. Like your Giloy preparations, amla preparation. Go for natural things. If you want to eat amla, go for a natural amla. Don't go for preparations that come in market, Giloy juice, amla juice, all that stuff. So these things can be dangerous in a long run. Not only in regard to the COVID, but we have patients who take Ayurvedic medicines. I'm not against any Ayurvedic physician, I'm sorry, but we see people, we generally call it a CAM intake, CAM. CAM is complementary and alternative medicine. This is a short term that we use in allopathy, and we have patients who, like, somebody is having a jaundice, which is the most common thing in India, okay, and it is the most commonly treated symptom in home. Everybody will say eat stem of this plant, eat leaves of papaya, or put some, wooden some chain in your neck, or keep matchstick with you, or all kinds of treatments you will have in the family. But consumption of any such drugs, like people who take gym supplements or things like that, so they'll land up in acute liver failure. Even youngsters are coming with acute liver failure, then the only treatment option remains to be a liver transplant. 90% don't survive.
So normal, balanced, healthy diet
Yes,
with
and you take
maybe
natural sources. No,
some
don't go for
citrus juices.
preparations,
Yeah, citrus or amla juices, that will be good enough.
but in the natural form, not the
In
prepared
Yes,
natural.
form.
yes, totally agree with you.
Sir, can we keep two COVID patients in the same room if I know at home? But
Sure, sure.
I mean, my brother has been tested positive 3 days ago. Now my cousin has been tested positive today. So can we keep both of them in a single room, in the same room?
Yeah,
Yeah, it can be done. In fact, most of the hospitals are doing that.
my father.
So, sir, one of them has cough and another one is completely fine. So there's a chaos that if one has cough, the other one gets it from him.
Usually not, but if you have facility of segregating in your house, it's fine. Otherwise, keeping them together is also okay.
Okay, sir.
There
Okay,
is one
thank you.
There's
question by
one more question in chat box.
Ojasvi, yeah. My father.
Gets fever at night. He had pancreatic cancer surgery in 2013. Tests are fine. There's no COVID. What can I be?
Well, getting fever at night and had pancreatic cancer, we will have to investigate from both points, from the point of malignancy cancer also, and from the point of COVID also. It can be either of them, so needs to be investigated. We can't rule out that once a cancer patient cannot get a COVID and vice versa.
So there is no fever and nothing, but there is completely weakness and all time feel tiredness. Then it is also COVID symptom.
Yeah.
30% of COVID patients do not have any symptoms at all. So without symptom, maybe COVID, with mild symptoms, maybe COVID, just like mild weakness. So there is a full spectrum of symptoms with COVID. So whenever
Okay, so sir, would you suggest that will we go? I want to ask that will we go for test? But I am asking about my mother only. She is like no fever, nothing. Any we have no symptoms like any COVID, but
Please, if not
observe,
you're testing
day
for
tiredness.
RT-PCR, get some routine blood test.
yeah, that will help.
Routine
Can be unlimited.
Okay, sir. Thank you.
Is it done? Every participants
Yes,
have asked
just
questions.
one. Just one. Please, if anyone is having any questions, write in the chat box or you can unmute yourself.
Um, um, you know, can I go with another question? This is, this is related to, I was thinking India has gone in for vaccination, and as you are encouraging us to go get ourselves vaccinated, we as a population, it's less than 10% who have got vaccinated up till now. What is that benchmark according to you that one should target in terms of the economy? Is it the 50% of the population getting vaccinated, or is it like Spain who have been targeting it to 80%?
Yeah,
What should we target for India?
70 to 80% is the target.
Okay.
So that you can develop the immunity against this virus. This is through the government of India.
Okay, that's the target that is supposed to be to be reached.
So yeah, in the second, third leg, children will be included. Definitely, children above 12 will be included shortly. So it's this trial is going on, not here, abroad, but definitely they will be included. So 80% population, 70 to 80% population need to be vaccinated.
Okay. Dr. Ushma, how long will that take India to do? I mean, achieve? What do you think?
That is really a big question, but government is trying its level hard to improve upon this production of vaccines. Also importing, they are trying hard, but it may take years, maybe take 2 years.
2 years, almost 2 years to
Maybe.
vaccinate 80% of our population.
Yeah. So that is the disadvantage of having a bigger population country here also.
तो 2 साल में डॉक्टर उष्मा 2 साल के दौरान जब कि हमें लगेगा 80% पॉपुलेशन को वैक्सीनेट करने में, उस दौरान हाउ मेनी वेव्स, अच्छा थर्ड वेव की तो बात हो ही रही है.
डेफिनेटली देखो, ये आपको प्रैक्टिसेस तो फॉलो करनी ही पड़ेंगी टू प्रिवेंट. हाँ, डेफिनेटली इकोनॉमिक लॉस भी बहुत ज्यादा हो रहा है इससे. सो something will be done, production will be topped up.
In fact, it's very unpredictable. Next wave कब आएगी और वो कितना सीवियर होगी या लेस सीवियर होगी, nobody can predict. But है कि हम अपने एंड के ऊपर अवेयरनेस क्रिएट कर सकते हैं कि whosoever has access to vaccine should get it done, and we should encourage our near and dear ones to get it taken and keep taking precautions.
It is a world over problem actually. So even countries, our European countries are trying to help us by definitely they have waived off that, what is that called, Saurabh sir?
Yes, ma'am, I'm here, ma'am.
They have waived off, what is that, patency money, what is that?
No, that patent.
Something.
Yeah, there was a lot of discussion on whether it should be given to the developing countries or not. Yeah.
It has been actually. US has come with the saying yes to waive off the
patent on the vaccine. Yeah.
Intellectual property right.
Yes.
So definitely, world is trying hard because it is problem all over. So vaccine production will be increased. It need to be increased. That is the only way.
Okay, and the small clinics do they have any role in that, in spreading the? I mean, in getting the vaccination being spread across the population. Small clinics. I mean, the clinics you were talking about earlier, doctor.
We are saying door to door. So maybe once the thing is settled, vaccine has been injected to a lot of people, and it has been assured that there won't be much of the reaction. The problem is in day-to-day clinic is anaphylactic reaction.
Okay.
So why you are sitting in the hospital after vaccination? Why you are in medical guidance for half an hour post-vaccination? Because you are watching the anaphylactic response. So once the things are settled, that it doesn't happen, because every clinic doesn't have facility to take care of anaphylactic reactions.
Right.
So once the things are settled down, definitely it will come to the private also clinics.
So we should be geared up for the coming 2 years, and unless we see 80% of our population getting vaccinated, that's the conclusion coming out of the discussion.
Yeah, that is what I have gone through the literature.
Thank you so much, Dr. Ushman.
Ma'am, I have 2 issues.
And now one more thing is coming up, that a booster may be required 6 months after the second dose.
Right.
Another burden.
I see that. Yeah.
What are the precautions for post-COVID patients? Like my mother just suffered from COVID. Now she's having, like those. She's very fatigued, and she can't stand up for more minutes, or she can't make. She's very tired, and what should we take precautions, or maybe what extra care should we give to her that she'll be better soon?
Just rest is the best idea for injury to heal up. Whatever injury has happened to the muscles, to the maybe collagen tissue, even your lung reserves. So best way is the rest. Rest is the only way which will heal up whatever problem has been there. Apart from that will be a good hydration and managing all those problems, whatever sugar, blood pressure, they should be taken care of.
Yeah, she does not have any issues like sugar or blood pressure, but she's just fatigue and
Yes,
she's get tired easily.
this
And
will settle down, no specific treatment, only a good hydration, good balanced diet and rest.
so should we go for steam like regularly for her? Or
Steam, I said, this myth is busted from my mind that steam is a very good thing. It is just okay. You should not take much of steam. Steam will just dilate your nasal passage for a few moments. So not much of steaming, just okay. Whatever comfortable, maybe 2 minutes or so.
thank you so much. Now
Ma'am,
I would like to call.
can you hold for a second? I need to raise one issue which principal sir has quoted, that how to increase the online teaching and other things in relation to this pandemic. So I have two issues to raise over here, Dr. Ushma ma'am, Dinesh Singh sir, and Dr. Ujjwal sir. First thing, you told that 80% population will be vaccinated in 2 years, in 2 coming years. So the first interpretation is whether we have to suffer it for 2 years or not. First thing, so that we can mentally prepare that we have to face it for 2 years at least.
So you follow the best practices. You follow the masking, which people are not doing. They're not taking it seriously. They're just moving like that,
Yes.
nothing, corona is nothing. So I would say beware of the situation, what is going to happen. Don't cry on the governments when you are not following the rules. So you should properly mask, use sanitizer, and be in very well lit, ventilated rooms, and take care of your natural immunity health.
Now the second issue which I want to raise, ma'am, कि ये सिर्फ एक संभावना है which I expect to happen. मतलब currently the dose of vaccine which we are taking and the new strains of corona is developing continuously. What if it happens like the current vaccine is not a cure for the next coming strain of corona? If that situation happens, what I think to ask now.
That is
In
quite
fact,
possible, sir.
in fact, this issue is
Is
already
really
being
possible, sir?
evaluated by the vaccination companies, and they are working on other variants of the vaccine. And the technical experts are looking into that. So we as a society, what we can do is to prevent this from spreading in the community by using mask, sanitation, social distance.
And I think take out some information from China, what they have done. That the virus has gone from their Wuhan. This is a Wuhan virus, and it is nowhere in the Wuhan now. They are holding all concerts, so somebody has to take out their secrets.
Exactly. Thank you very much. Anyone needs to ask anything?
There's one more question. How is it possible to get everyone vaccinated as if it has to be repeated after 6 months to 1 year?
It's all
Well,
right.
well, the answers are not there. In fact, a country like Britain, they have vaccinated close to 60% of their population. And then there are countries in Europe like Switzerland, which have done to less than 10% of their population. So within Europe, we are having so much of variations. About India, it is only guesswork.
So there's no certainty of it.
But we will. Definitely, we will.
So मतलब कहने का the last thing which is bottom line is coming is अगले 2 साल जो है हमारे लिए we have to tighten up ourselves and keep ourselves on the watch, that we are not take all the precautions.
Yeah,
I think वो करना है साथ में, जो जैसे मैंने अपने टॉक में कहा था कि एज ए कम्युनिटी हैज टू गियर अप. हमें थोड़े थोड़े से टास्क ग्रुप बनाने चाहिए अपने उसके अंदर. कॉलोनीज के अंदर, अपनी सोसाइटीज के अंदर, जो अगर थर्ड वेव आती है तो उसके लिए हम लोग अगर पहले से थोड़ा प्रिपेयर्ड होंगे तो हम उसको बेटर टैकल कर पाएंगे।
हाँ, जैसे कि सर आपने बताया कि जैसे उष्मा मैम भी बोल रही थी कि लोग लूज हो जाते हैं, दे बिकम रियली, दे डोंट वरी अबाउट इट। तो ये कांस्टेंट इंफॉर्मेशन जो है ऑफ अवेयरनेस, दिस इज आल्सो समथिंग व्हिच इज अ चैलेंजिंग टास्क कि हर बारी कोई कितना बोलता रहे, यू नो। फर्स्ट वेव आया गया तो पीपल बिकेम वेरी लीनियंट, वी वर सीइंग पार्टीज ऑल अराउंड दिल्ली, एंड द यंगर जनरेशन को, जिनको आप कह रहे हैं फोर्स में लगाएं, उनको पार्टी करना है, दे आर द वन हु आर पार्टिंग, या आप कह रहे हैं उनको फोर्स में लगा दिया जाए, तो ये कहाँ तक पॉसिबल है?
Society has to think about it, otherwise it is going to be devastating to the country.
Kanu wants to say something. Kanu?
Also,
I think, sir, I think that universities, especially Delhi University, in which we are a part of, can play a catalyst role in that.
Teachers and universities are the best place because there the student, maybe children or maybe elder one, they will listen to teachers.
Yes, so orientation of the younger generation can be done through the universities. I think the universities, I'll be frank about it, universities have not been doing
the society is reflection of teachers.
Yes, definitely, ma'am.
Society is definitely what teachers make, because children or maybe elder students, they listen to their teacher. Now they listen to the teacher. So I think universities को programs करना चाहिए government के साथ मिलके.
Right. I agree to you, ma'am. I agree to it. अगर आपको younger task force बनानी है, तो orientation तो बहुत जरूरी है.
Definitely.
जैसे ही relax होता है थोड़ा rule regulations, थोड़ा relax होते हैं. We see the younger generations who go to straight to the restaurants, and and that is what we saw in the first wave also. So the continuous gearing up, as Doctor also said, is a challenging task. I understand, but the universities can pitch in, to materialize it.
I hold great regards to my school teachers, to my college teachers. So I think most of the people are like that. Saurabh sir knows I could not definitely continue on FMS because of that maths problem. but I really hold great regard for FMS also.
Yeah.
So definitely, you are management people and you can definitely manage all of them.
Right. Ma'am, we will try our best, and this is first step. Saurabh sir has taken this step from our department. And it's acknowledgeable for it's appreciating.
I can assure from both of us that we will definitely pitch in for any help.
Yeah, we'll organize more of these sessions and bring in more of the younger lot, so that they can be oriented, and we can achieve the task force that we are targeting. Thanks.
Thank you so much.
Yeah.
Kanu, can you continue for the vote of thanks? Who has to do this?
Sir, sorry, sir, I couldn't hear you.
What next we have to do?
Sir, I would like to call you only for giving a vote of thanks for our doctors. Over to you, sir.
Yes, thank you, Kanu. And I personally feel that today's lecture is very much beneficial and informative to the people who are suffering, living in this pandemic age or the era. And our principals are already quoted that we have to mentally prepared for everything, and being in teaching community, we all have to be prepared for the online teaching efficiency of the teachers. So this lecture, I'm sure that it will be very much helpful to the teachers and the students as well, so that they can improve their lifestyle and their living style, and they can survive a better life. Coming to the next step, I am very much thankful to the organizing team and technical team of the college who supported us in a very short notice period, and they given us to organize this event, which is very much important in this pandemic, and which we have been planning to conduct since 10 days. In the next part, how can I say, I don't have the words to thank to the doctors who came here to deliver their informations regarding the pandemic situation, and to the patients or the non-patients or the people who are suffering or who have suffered or who may suffer with the COVID in the coming times. So what I can say, the living gods are here who are saving the lives of the people. Not more than that I can say for their phrase, but I'm sure that with the help of these information provided by our guests and the doctors, we all will be very much healthy and living in a good lifestyle and to survive a better life in the coming future. And now we are very much assured that how far we have to face these situations. The key master stroke statements has been already given by Dr. Ushma ma'am, Dr. Dinesh sir, Dr. Ujjwal sir. Wear the mask, 2 layers, triple layer, surgical mask. That is the best way to prevent yourself from COVID infections, and we have to suffer it for the long time. So I'm sure you all will be taking steps with these informations. And on behalf of the whole college community and the organizing team, again, I'm very much thankful to the doctors. Thank you very much, all the guests, for coming over here and deliver us the information.
Thank you. Thank you so much for inviting us and participating in the discussions.
Thank you, sir. And we hope you all will be connected with us in the future also.
Sure, sure. Looking forward
We expect
to
this.
Yes, definitely.
Thank you, sir.
More
Thank
than
you, sir.
So,
okay. Bye-bye.
Thank you everyone for joining. Stay safe and take care.
Thank you.
Okay.
And you
Thank
also
you.
take
You also.
care.
रविंद्र सर, let's end the meeting और YouTube वाला भी बंद कर देते हैं सर लाइव.